You want to live your best life. We try to help people live their best life and their best skin.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Dr. Shannon Trotter. Dr. Trotter is a board-certified dermatologist, the host of the podcast Dermot Trotter Don't Swear About Skincare. Thank you so much for joining me, Dr. Trotter.
Well, thank you so much for having me on. I've always been a huge fan of yours, so it's like a highlight of my career to come on your podcast, Janelle.
I appreciate it. Well, you know what? I had a lot of fun on your podcast. That episode aired, a couple months ago now. Mm-hmm. But yeah, that was a lot of fun. It's exciting to connect, but I'm excited to chat with you and to hear about what got you into dermatology in the first place. But you're from Xenia, Ohio, right?
Yeah, fun fact, bicycle capital of the Midwest and first F5 tornado to touch ground in the United States that's recorded. There's even a Weather Channel documentary on it for anyone who is a storm chaser.
Really? That is wild. I had no idea.
Wherever I moved, I always find a basement.
Yeah. Does that make you a Buckeye fan?
Yes, I did grow up a Buckeye fan. Sadly, also a Bengals fan. It's been a tough ride, but yes, definitely a Buckeye fan.
One of my brothers is a hardcore Bengals fan. I try to avoid being in the room when he's watching a game because it gets intense, but
it teaches you a lot of discipline. And I tell people it teaches you to stick through when things just aren't looking good. You learn some perseverance being a Bengals fan. That's for sure.
So tell me, how did you get into dermatology?
Well, it's actually probably one of the last places I thought I would ever be. I actually had a colleague of mine, a dermatologist, Kathy Bayless, back in Beaver Creek, Ohio. I forget even how we met, but she said, have you ever thought about dermatology? And you need to come check out dermatology. Come to my office. So I just spent a few Saturdays working with her and I thought, wow, this is kind of cool. You know, you get to see a wide variety of patients. I liked kind of the fast-paced nature of it. And really what clenched me to really want to do derm was a patient that I met when I was working with her. So this patient had psoriasis, really bad, probably about 80% of his body was covered. He had joint involvement. He had a lot of difficulty walking, being mobile. And he even told us in the room, you know, I've been on disability. I've been depressed because of this. You know, I don't have a job. He said, I don't date. And he basically just said, I have no life. You know, psoriasis is my life. And I think I was just really touched by that because I don't know that I'd had that kind of experience yet on some of my rotations about the impact of how somebody's skin, let alone a medical condition, could be affecting them. And luckily at that time, we had some new medications that were coming to market. The biologics, your area of expertise, were just getting on the horizon here. So one of the first ones that was available, he was put on. And I actually got to see a little bit of that process at the time and challenges there, as you know. But I got to come back and see in follow-up how it essentially cleared his skin almost completely. And he said he was able to move around more. He was working toward getting off disability. He said he was even dating and he was applying for jobs. I just thought, selfishly, you know, I was like, I want to have that impact on someone's life. Look how transformative affecting his skin truly was. Like he was back in the game of life where he was on the sidelines. And I think, again, that just said to me, wow, you lower somebody's blood pressure by 10 points, and they could probably care less to a degree. I mean, some people do care. Some patients do. But look at how we changed this man's life around by impacting his skin. And for me, then on, I'm like, derm, I got to do derm. I want to be able to do this for someone.
That's amazing. I mean, making that much of an impact on somebody's quality of life is huge. We see so many patients on a regular basis. I mean, even from me on my side of the access, you know, the prior authorizations, but being able to have that conversation with patients and seeing how much it changed their lives, how much it impacts them, it is so important. And I love that. So after working with the doctor, where did you go from there?
So after kind of learning, okay, dermatology is my jam. I think I want to go on and do this. I applied for dermatology residency programs, and I wound up graduating from the Oblenis Memorial Hospital program, which is technically under the umbrella of Ohio Health. It's based out of Athens, Ohio, but we actually did a lot of our training also in the Columbus, Ohio area. So that kind of is the pathway that led me into dermatology, and had a great experience there, managing all kinds of different patients, and also working with underserved area, here in Ohio, especially that tip of Appalachia and the Athens area, which brought a whole nother host of challenges I think we don't sometimes see in healthcare, especially depending upon where you are in Ohio, if you're more of those urban locations.
And so you also did a fellowship in cutaneous oncology as well.
So being from Ohio, I lived here. I went to undergrad at the University of Dayton. I did my residency here. I went to med school at OU HCOM, or Ohio University. I need to get out and see what other education in derm, can I get that maybe would expand my horizons a little bit. And while I was so grateful for what I got here, I know going somewhere new would offer me a new opportunity. And during my residency, I really developed a passion for skin cancer. We saw a lot of it. Had to come up with creative ways to manage, sometimes because of patient preference, or patients maybe couldn't handle the treatment that typically would be recommended. And I also had a special interest in CTCL, or cutaneous T-cell lymphoma. And I just didn't see a lot of that because of its rarity during my training. So I was looking for opportunities. I've always been a little bit enamored with the East Coast. Call me maybe just romanticized by the Americana nature, the location. Boston, such a huge academic hub. So I applied for a fellowship there at Boston University in cutaneous oncology. And my goal was to get better at managing and seeing cutaneous T-cell lymphoma, also have some exposure to melanoma, as well as non-melanoma skin cancer. They didn't do Mohs there. This was mostly other surgical management exposure to Mohs, but not a true Mohs fellowship. But it really helped enhance my understanding of skin cancer, where things were headed, and then really inspired me to come back and join the James, actually, where I headed the pigmented lesion clinic over there and really got to manage melanoma on a different level.
That is amazing. So you enjoy the psoriasis side and you work with melanoma and skin cancer. Now you talk a lot about alopecia. And so there's so many different aspects in dermatology. I'm sure you treat so many different things, but why is alopecia a hot topic right now?
Yeah, I think in general, alopecia, I always tell people, the famous Oscar slap kind of drew a lot of attention, to the alopecia world. I think people knew about it before, but, and specifically with alopecia areata, it kind of gave it some new recognition and awareness. But alopecia in general, some people might complain of a little hair thinning, or they're like, oh, I'm just getting older. And really in dermatology, through residency training, getting out, I got to see a lot of scalps and really identifying alopecia on a different level, just obviously seeing different reasons for it, but then also just the huge draw of patients now coming in, the awareness of, I have hair thinning. It might be more hereditary or age related. Okay, I can accept that. Or maybe I do have a primary disease in my scalp skin, or maybe I have something more internal going on. I have, thyroid issues or nutritional deficiencies. So I think, just kind of seeing it all encompassing with patients and dealing with on a regular basis. And then patients just having this desire for treatment and truly just seeing the impact it had on quality of life, just like that psoriasis guy that inspired me. And I just ended today's clinic with an appointment that's typically like a 10-minute slot. And I was definitely in there longer than that for a new alopecia patient, and trying to really validate their concerns, their understanding, and the approach has just become kind of a passion of mine. And to actually see now that we have treatments, that are coming out, like you mentioned, that are making the experience more rewarding, in particular for alopecia areata, it's kind of a game changer of treatment, because before it's been tough to offer people treatment and not always see much, reward for them. Now that we have things that can actually make a difference on a different level, it's been such an exciting time to be a part of it.
So there's different types of alopecia, right? Can you break down what those are?
Yeah. So I think, when people talk about alopecia, people just come and say, oh, I have alopecia. And I'll say, well, you may. But the important thing is, what kind of alopecia or hair loss do you have? So I try to remind our patients, again, alopecia is just a simple medical term that refers to hair loss. And then you can have different types of hair loss. And sometimes you can have more than one going on to boot, which can make it even more complex. So, technically, in the dermatology world, we'll talk about hair loss as being scarring or non-scarring. And then we'll put different types of hair loss under those categories. So for non-scarring, scarring, we'll talk about alopecia areata, which is a type of autoimmune hair loss. And basically, the hair follicles are being attacked and destroyed. And then you can also have that age-related thinning or thinning that we see that's hereditary, and we'll call that androgenetic alopecia that's also non-scarring. Then you can also have telogen effluvium, where you might lose hair 3 or 4 months after a traumatic, stressful event to the body. That can be emotional or physical in nature. And then sometimes medications can also cause that, where you have a sudden shed or loss of hair. Then on the other side, you have scarring hair loss, which is the tougher one to manage, because once those hair follicles are eaten up or scarred up for different reasons, whether that could be lupus on the scalp or a type of hair loss called lichen planopilaris, and there's a few others in that category, that's a tougher one to kind of manage because of the fact those hair follicles, once they're gone, it's hard to get those guys back. Essentially, we're not going to be able to. So you're really trying to halt that hair loss and preserve what they have. And then complicating matters, folks can have hair loss because they have internal issues. Stress definitely plays a role. And again, sometimes there's an overlap. And so you're trying to tease through this. It's much more complex, which is why I try to explain to that patient. So doing it quickly is not always possible. You do develop a sense of efficiency, so you can really address their concerns. Make sure you identify the cause or causes, because that's really going to dictate your treatment and hopefully some success for the patient as well.
Do you feel like there's a lot of misconceptions about the types of alopecia, or, if they see a commercial or they hear that there's a medication and they just think, oh, I need that?
Oh, definitely. Everyone wants to, take biotin because it's all over and like, oh, I read biotin's good. Or I went into, my local grocery store or drugstore and I saw a hair and nail gummy. So this must help me. And, we talk through folks about that isn't really great for straight biotin by itself. And in fact, it can impact thyroid labs or cardiac lab tests, your heart enzyme tests that aren't really good. So it's not always our first starting point. So I feel like there's a lot of myths about, supplements are going to make our hair grow better. And really, the data is if you have maybe a deficiency, supplements might be helpful. But in general, are they overly helpful if you don't have one? Probably not. Now, that being said, sometimes I'll have my patients like, hey, I really want to do, Viviscal or Nutrafol. And I'll tell them, yeah, there is some reasonable data to suggest they could be helpful, but often they're a part of a larger, treatment approach, to hair loss, and I think people too just assume everything's age related, or sometimes even my colleagues in primary care be like, oh, don't worry about it. You're just thinning because you're getting older, but maybe they haven't really looked at the scalp to see there might be some subtle, changes or evidence of scarring that would suggest maybe we're in a completely different ballgame of how we want to treat. And I also think, too, people think treatments are just terrible. I wouldn't say they're terrible. There definitely are some types of alopecia or hair loss we're better at treating, but there's new things coming up on the horizon. And so there are opportunities to really kind of go after it. And the big philosophy I tell my patients when I'm treating it is twofold. One, the big priority is to stop further loss. 2, regrowth. And usually the patient wants the exact opposite. They're here for regrowth and not really to maybe stop further loss yet. And I tell them, honestly, that's what we're most, I think effective sometimes at is really halting the process, whatever it is, and then trying to wake up sleepy hair follicles or, try to get things going again or increase that blood flow or nutrition around the hair follicle. We have different ways to do that, but it does depend upon that hair follicle. Some are more easy to motivate, and others aren't so great. So I think just sort of resetting expectations, identifying the type of hair loss, that's what's really important. And then also understanding your patient. Some people want everything in the kitchen sink. Other people want a more gradual approach, or they're looking for things that are less invasive, less risk of side effect. So I think understanding that patient, reading the room, that way you can really devise a plan that works for them and really just kind of, walk them through it. Because I think just being their partner in treating hair loss is really important.
So as far as like lifestyle changes or dietary recommendations that can support hair health, how do you approach that with patients? Because I feel like patients are really wanting the most natural way possible.
Yeah. So I think it is tough, like to when you approach those, like, what recommendations can you make, and I tell patients it's kind of just the common sense approach. Again, we're looking now at, certain supplements and trying to see, is there a value in doing one over the other? Or people are like, oh, I followed this diet or that diet. And I tell them, well, okay, there's really like nothing that I tell you, like go out and do, the Atkins diet or do the low carb diet or go out and do paleo. And I think it's going to help hair. I said, in fact, doing any type of, big dietary changes that are sudden can actually cause hair loss, especially if it's associated with rapid weight loss. So I try to, first of all, try to reset the button and say, eating a well-balanced diet. I am a big proponent of the Mediterranean diet. I do think there's some great health benefits overall that may also be beneficial, for hair loss too, that I think that that's a great approach for most people if they're able to do that without restrictions. I recommend definitely minimizing stress, working out if they can get their exercise routine, hydration, all the things we recommend for general health. I'm a firm believer are really connected to your skin health. So patients are sometimes shocked by that. Part of that might be my osteopathic training philosophy. I mean, we really look at the whole person. And I do think this is catching on more in the sense you've probably heard this integrative dermatology trend where, we're looking at traditional methods of treating, which does include sometimes medication, looking at the pathophysiology, but then we're combining that with, okay, let's look at diet, let's look at exercise, let's look at your stress levels, that mind, body, spirit connection. Because I am a big fan, personally, professionally, that you can't really separate the two. And I think too, that's the way I live my life on treating skin, that like, you want to live your best life. We try to help people live their best life and their best skin. And that's the best version of you too. It's not, what you see on social media and all the trends and their perfectionism and how everyone's touched up and you think your tone has to be perfect or you can't handle dealing with a blemish. My team was making fun of me even today. They're like, you never break out. You've got a pimple on your chin. And I said, I know, it's all that sunscreen I was using over the weekend. But I said, I want people to know dermatologists, we're human too. Like we get pimples too. But I think that whole
No way.
Yeah, we do. I was going to put a pimple patch on, but that might be a little too much for the podcast. But we do use them. And so I always want people to know when I approach it, I'm not really into fads. I'm into more sort of balanced approach. And my patients will laugh because they're like, you want me to use a mind body app? What are you talking about? And some of them are more open to it than others. But it's amazing when they try it and come back that it's not only does it help their skin or maybe how they're feeling, but in other aspects of life. And again, I think that's my philosophy. I am their dermatologist, but I'm also trying to help them live their best life in the capacity I can, obviously addressing their skin. But there's a few other things that we can sometimes tackle or at least point them in the right direction to get resources. And sometimes that's checking in with my colleagues in psychology or psychiatry or going back to their family medicine doc because we've got to address this weight loss more aggressively, or we need to cut back smoking. The hard conversations. I'm not saying I'm the one that always convinces them, but I have an awareness and I integrate that in.
So what about when you have a patient that is a child, a pediatric patient? I mean, because that's probably more autoimmune related, right?
Yeah. It's crazy to walk in because it's not affecting them, but it's affecting the whole family. As a mom myself, if I saw my son or daughter losing their hair, sometimes maybe as the parent, I would be more concerned than sometimes the children are. But especially depending upon their age, that's impacting their social and emotional well-being. They're going to school. Children are often a little too honest, maybe commenting on it, maybe even teasing. And, too, internally, some of them might play it off, but it's impacting how they feel and how they really, see themselves in everyday school or social events. And to me, this just has that trickle down effect, for somebody that's not functioning at their highest level in school every day and be able to socialize with friends or do that math test, they're not being the best version of who they are. And when you have a child come in, it's just heartbreaking. And you can see that on the parents' faces as well. And you're right. Typically, a type of hair loss is often autoimmune, often fits more for alopecia areata, where classically they'll have that patchy version, those isolated patches, but they might have involvement of the eyebrows or eyelashes or other body hair. And so it can be very, very, just self-conscious, for those kids. And so you just, like I said, your heart breaks for them. And treatment's tough because you're now integrating in the parents who have concerns, over like, what can I do? What do I have options to kind of help treat that? And then also, what a child can tolerate because it is more challenging, with some of the treatments that we offer, that it's something they want to treat, but it's also something that doesn't happen overnight, especially for that type of hair loss. The hair loss can be sudden. And unfortunately, although we work back to get that growth, it's not a quick process. And so it's taxing on everyone.
Typically, how long does it take for hair to grow back?
Yeah, so when you're seeing through the growth cycle, I feel like it's variable. I think that's what's kind of frustrating because that growth cycle is thrown off balance, with that attack of the hair follicles. So, I've had patients where, say, for example, they have that patchy alopecia. We decide to inject them maybe with corticosteroids or steroids directly into the skin. Some people within one or two injection treatments, maybe separated out by 6 to 8 weeks, are already getting regrowth. Then I've also had patients, it's like we're on, injection number 5 or 6, we maybe have increased the concentration and we're just not seeing much of anything. So it is a little unpredictable and sometimes they're more difficult to treat areas like on the back area of the scalp where we call like the ophiasis distribution that makes it more stubborn. We don't know exactly why that tends to be clinically stubborn, but for those patients, we kind of warn them that it might be a longer process. It's one of those things that we kind of try to walk them through a little bit, again, the expectations. And some people too, they just stay patchy. You get one area gone, but then a new one pops up, or they're even good for a few years and they get new spots. That can be part of the challenge too, is just kind of managing those expectations.
Do you ever partner with them to say, hey, maybe we should seek some outside counseling for this to manage your stress or anxiety or depression?
Yeah, I think that's a really great question that you asked, because it's one of those things I think for skin, a lot of people just underestimate the emotional and mental toll that it takes. And sometimes even in the room, because as dermatologists, we are seeing patients rather efficiently and we can forget. And, sometimes the patient will bring it up and more often not, I think it's on us to bring it up because they may not even recognize it, especially in children. Sometimes, kids can cope and they can mask things very well. Or maybe sometimes the parents think, oh, it's because they had a fight with their best friend at school. That's why they've kind of been stressed and they don't really understand the impact that hair loss can have on them. So typically, I will talk with them a little bit about, oh, how's school going? Are you playing sports? Are you sleeping okay? Like more even as I'm getting maybe the treatment ready or I'm doing the exam so that, it's more conversational, more relaxed and we're addressing it. And I'll even look to the parents if it's somebody that's a child that's in there to sort of get some feedback too. And then I'll talk with them about, sometimes hair loss can, we think, be triggered by, something stressful to the body, mentally, emotionally. And then sometimes hair loss causes stress. And it's like this terrible vicious cycle. And we always tell patients, regardless of age, it definitely can impact, your ability to cope with having hair loss and then, really impact also those treatments, probably their ability to work because we know stress increases cortisol levels in the body. It affects the immune system, especially with alopecia areata being autoimmune. It's having an impact, even though it's hard for us maybe to quantify what that is. And so often, if they're amenable to it, I'll say, hey, do you have a pediatrician? Do you have a family medicine doc? Or we even have a psychologist as well, who's really good at helping us get people connected. Because I know it's not my area of expertise to actually manage it, but I do think as a dermatologist, for most of us, it is our area of expertise to ask about it and maybe recognize some of the early signs. So again, we're going back to treating that whole person because helping that aspect will only be good for us treating their hair loss. Ignoring it isn't good. And some people too, it could be a triggering event. Maybe they had some underlying anxiety that was made worse by the hair loss. And even if their hair loss gets better, they could still struggle with anxiety that kind of just blossomed because of that condition. But then it's not being addressed and maybe it's being furthered by, tests at school or issues with relationships. So I think, again, that connection has to be there and we have to make time for that in dermatology. And sometimes it's not on the first visit because you don't have much rapport. You're building that. And then you can really try to pull that out of somebody. And it's important to keep in mind, everyone is affected differently. Some people it's more significant. Other people it might be milder on the spectrum, but we definitely do a great service to patients by at least asking.
Yeah. I've always thought about that because we do talk so much about quality of life and how it impacts their patient and their day to day. I wonder if any dermatologists do partner with, counselors or talk to patients about seeking outside additional help. I'm sure it's needed.
And a lot of us too, I think just, our day-to-day schedule, it doesn't allow for it. And we're not experts in that, although we can see the impact it has for somebody. And it's hard because getting a patient to admit it is difficult. Some people do have great insight though, and especially as an adult, anxiety can manifest in so many ways. Like I had a patient with alopecia areata that came in secondarily for hand dermatitis. And I was taking a peek at their hands and they're red, they're, rashy looking, they're burning. And I said, are you washing your hands a lot? And they're like, yeah, I wash. And I said, well, how many times a day are you washing? They're probably 80. And I said, oh, that's a lot. And I said, are you having trouble, feeling like they're just not clean enough? And they're like, yeah. And then sometimes too, like, I just feel like, I've had this hair loss condition. I was worried that it was because my scalp was dirty. And so, I was washing my scalp a lot too. And so, we kind of sat them down and talked more about, again, the type of hair loss you have has nothing to do with your hygiene or what you're doing. But it was causing a lot of anxiety. And then the anxiety was sort of manifesting secondarily as an OCD, an obsessive compulsive disorder of chronic hand wash that then came into our office, but presented more like hand dermatitis, or we might call it irritant contact dermatitis from that chronic soap and water exposure, of course, no rebuild of the barrier with moisturizer, the whole bit. And it just was amazing to see, like, wow, where it started with, just the hair loss really triggered that anxiety, maybe a misconception of why the hair loss was occurring. Now focusing then on the hands to kind of cope with some of that anxiety. It really was fascinating and also scary too, to see how ignoring that or maybe not picking up on it and getting that help for the anxiety earlier on sort of presented as something else completely different. And although it's a skin issue, the here and now, we got to treat those hands getting better. It's really a larger picture issue of helping this little boy cope with his anxiety.
Wow. So you often tell your audience not to beat themselves up over past skincare habits like tanning or using baby oil. But I feel like your podcast, you really have a good way of explaining things in general for not only your colleagues, but for patients to understand.
Yeah, that's the whole goal. So like I'm that nerd. I love patient handouts and patient education. That was me in my spare time. Like, how can I explain this? What analogy can I use? Or I love it when patients and I are on the same page, because I truly believe we're partners in their health. Like, yeah, people come in and say, doctor, just tell me what to do. What do you want me to do? But in this day and age, people are educated. They're on Google, good or bad, learning about things, and they want to know. And sometimes we forget. We just simply forget to break things down to the basics. What kind of skin condition do I have? How is it going to behave? What is going to be my treatment? What are my options? What's the good, the bad, the ugly? And so the inspiration for the podcast, I was looking around here and I'm like, it'd be nice to have more dermatologists contributing to this, because we've kind of been on the sidelines a little bit. There are a few of us out there, which is great. And I thought, well, we're doing a lot of social media, but we really haven't jumped into the podcast arena as much. And I was kind of inspired listening to you, and I thought, maybe I could do this. I can talk. So maybe I could bring people on, my colleagues that are experts, and help them distill down something that's complex. Like, take something that, that's high level, that you talk about the data all the time, or the clinical trial, or the statistical analysis. But how do you talk about it with your patient? What's the conversation you have at the bedside? So when people have questions about a particular skin condition, or maybe something as simple as collagen, they're like, I just don't know what the right answer is. I saw a TikTok video on this, and I saw, an Instagram reel on this. I just wanted to bring that down to a level for the public, for, yes, our patients, but just anyone to find out about. And what's really nice is we've had a lot of family physicians, pediatricians, also NPs, PAs in the dermatology space like it, because it really cuts through the fat, where, yeah, you sometimes want that high level data analysis and critique, but sometimes you want a little help. Like, how do I talk about this with the patient efficiently and effectively? And so I feel like that's the goal of the podcast on that level too. And it's been a blast. It's really been fun. We hope to bring on some patient experiences too, to the reverse, to maybe help on the healthcare providers, bring on some patient experts to help them understand their disease state a little better too. So I'm hopeful this year we'll see some kind of interesting changes we do to really expand just that exposure for patients.
Yeah, that's exciting, because you're also on faculty for the Ohio Health Dermatology Residency Program. So you probably get a lot of your residents that are listening into the podcast and learning a lot too.
Yeah, I hope so. They better be listening. Yeah, some of the residents will pick it up. So, one of them, I was kind of teaching, like, I don't know if I'd listen to something that's meant for a patient. I said, well, but think about it. We're having experts on that are going to give you the latest and greatest information. So it might even be in a talk that they might have just given at a conference you went to. You're just going to hear it in a different capacity. And again, maybe in a way that you can break it down for a patient to understand. So that's kind of been the fun, with integrating it into education. We have a lot of medical students. So I actually have medical students rotate with me constantly throughout the year. Some want to do derm, but a lot of them are going into other specialties. One of them, he's going into OB-GYN. And he said, oh, I heard you have a podcast coming up for skincare down there. And he's like, I want to listen, because he said, honestly, I don't know what to tell my patient. And I thought that's kind of a cool way to overlap with other specialties too. So the med students have also had a lot of fun, just learning more about derm, and it's really piqued their interest, which I think is great.
Yeah. Well, I'm excited to continue listening to your podcast and hearing any of your new guests that you have on. If you could give one piece of hair care advice that applies to everyone, what would that be?
Ooh. I think the biggest myth is that you want to do the hair care routine and washing that's right for your hair. I think the assumption I see is everyone's like, oh, well, this person said I can't wash every day. That must be terrible for my hair. Or this person said, no, I have to use this particular product. For hair care in general, it's really about your own individual hair needs, but also your scalp needs. I think a lot of people for hair care, they just think about our actual hair. And when you think about underneath all that hair is the actual skin, your scalp skin. So taking good care of your scalp skin is what's actually very important. If you take good care of your scalp skin, often that can lead to better hair growth as well. And so for people that come in and say, oh, I was told I can't wash every day, it's terrible. And I tell, well, not necessarily. It depends upon what products you're using. Are you using a lot of heat exposure afterward? But some people may need that wash every day, especially if they have a scalp condition that requires more washing. Then other people might, no, I can get away with washing every 2 weeks. I don't have any scalp issues. My hair is healthy. So I tell you, in general, it's hard to say like one routine for everyone. What I really just recommend is looking at your individual hair care needs or scalp needs, and then following the regimen that works best for you. Because it is really hard to just say this is perfect. And that goes for skin too. Because some people are dry, they're oily, they're acne prone, they're more interested in anti-aging, they get a little red like me with rosacea, this whole wide variety, that to say this is perfect for everyone, not necessarily the case. We're all individuals. And like I mentioned before, you want to be the best version of your own skin. And so doing that to the level that works for you is what's important. And that goes for hair care too.
That's awesome. I love that. Well, thank you so much, Dr. Trotter. So if anyone wants to find your podcast, where can they listen?
Yes, they can listen. You can find us on Apple and Spotify. We're also on other major streaming services. You can also check out our website at www.dermattrotter.com.
And then if anybody is listening and they need a new dermatologist, where can they find you?
Yes, I'm with Doc's Dermatology, so you can go to our website to check us out. I practice in 2 locations, the Springfield, Ohio area, as well as the Canal Winchester, Ohio area. Unfortunately, right now in Springfield, I am not taking new patients. We are crazy busy, but I do have a couple colleagues up there helping me. So call if you do need, any advice. We're always happy to help. We're here to provide, like I said, dermatologic care in any way that you need. And thank you so much for having me on the podcast, Chanel. This was awesome.
Yes, thank you. We'll talk soon.
That sounds great. Take care.
Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.